Hello, my name is Keerthi Gogineni. I'm an oncologist at the Abramson Cancer Center at the Hospital of the University of Pennsylvania. And on behalf of my co-authors, I'd like to share with you a brief summary of the results of our study investigating the impact of oncology drug shortages. Since 2006, reports of drug shortages have been escalating. Most of the shortages are concentrated in the sterile injectable market, and as a result, oncology drugs have been especially susceptible. Yet most of what we know arises from compelling but anecdotal stories about shortages in agents used to cure and treat patients with cancer. To date, there's been limited empiric data quantifying the extent of the shortage in the US, which drugs are in short supply, how oncologists are modifying care to adapt to shortage, and what guidelines they're relying on in order to make those modifications. We contacted a random sample of 500 U.S. oncologists and hematologists in the U.S. between September of 2012 through March of 2013. 250 oncologists completed the survey for a response rate of eligible 55%. 214 medical oncologists and hematologists completed the survey, and we limited our analysis to that sample. 83% of those we surveyed were unable to prescribe the preferred chemotherapy agent due to shortages. Of those who faced shortages, 94% reported that their patients' care was affected as a result. When confronted with shortages and cheaper generic agents, nearly 60% had to substitute a more expensive branded agent. And despite the prevalence of shortages, nearly 70% said that they had no formal guidance to aid in decision-making when faced with a drug in scarcity. On the right, you see a table reporting the top 5 generic agents described to be in shortage. Nearly 2/3 of the sample reported shortages in leucovorin and liposomal doxorubicin. Leucovorin is a drug used in colorectal cancer and to reduce the toxicity of lymphoma and leukemia regimens. Liposomal doxorubicin is a drug used in many cancers, including breast, ovarian, Kaposi sarcoma, and multiple myeloma. 5-fluorouracil is a drug that's critical to the treatment of colon cancer. Bleomycin is a drug that's used in Hodgkin's lymphoma and testicular cancer, curable cancers that affect young adults. And finally, cytarabine, a drug integral to the treatment of leukemia, was reported to be in shortage by 16% of the sample. On the right, you see how oncologists adapted to shortages. Nearly 80% of the sample reported having to make a change in regimens, and 77% reported having to substitute a different drug partway through treatment. 43% of oncologists had to delay treatment. When faced with too little drug and too many patients, 37% had to choose which patient would receive the drug in shortage. Oncologists and hematologists were forced to omit doses, reduce doses, or refer their patients out to a different cancer center or group thought to have more of the drug available. In sum, the vast majority of the oncologists and hematologists that we surveyed faced shortages of agents used to cure patients and treat patients with cancer. These shortages forced providers to modify preferred treatment regimens and raise the cost of cancer care. Despite the prevalence of scarcity, the majority of those we sampled had no guidance to aid decision-making when faced with a shortage. Thank you.
So.